we need to obviously assess our patients. This is the second session that I'm going for this particular patient, and this is last time we treated him was in May. So this is like, ending 5 months now, and we've already noticed significant improvement of these acne scars here, and I suspect once we've done the second session, I hope to achieve more than 80-85% of clearance of these acne scars. We discuss our instrument that we're going to use. We're going to use 22 gauge cannula. You can use 18 gauge cannula as well. The larger the better it is. I get a better control if I use a bigger gauge cannula. I prefer 18 gauge when I'm doing them on the first time. On the second time, because the scars have significantly improved, I can use a 22 gauge cannula, which I am using in this case. Ideally, you should be using a which has 210 milligrams, and you normally reconstitute this with 15 mL of water, or you can use saline, right? But because we don't have a today, we are using, and this is usually reconstituted with 40 mL of water or normal saline, and it has 630 milligram of PLLA, so it's actually 3 times the dose of this bottle. But we'll be using the amount that we normally require for our acne scars in the patient. Now, the way I reconstitute this, I have mixed this with 40 mL of normal saline, and I took 5 mL of, or in this syringe, and I further diluted this with 5 mL of normal saline with lidocaine in it. So because it was kept for some time, you can see the particles are already sedimenting, so every time you use them you must shake them very well so that the particles are well suspended. We start with giving local anesthesia at the point of entry. Now, because I want to target this area, all of it, I'm going to make a little unusual entry point. Usually I would use my entry point here, but in this case I'm going to use it along the beard line so that I have maximum coverage area. Treat all this area in one go, and because I want to do a little deep injection here, I'm just going to do a deep bolus on the cheek. Now, the first bit I'm going to do is, this is a 3 ml of 1:1 dilution of PLLA. I'm going to instill 1.5 right on supraosteal plane, right? So this is going deep under the muscle, supraperiosteal plane, and I'm putting volume here with lidocaine in it on the scars, on the acne scars. Okay, so we go here again. Scars, otherwise this bending the cannula. Benefit of using a cannula here is that you're working in a bloodless field, you're not working in a traumatic field. Now onto the temporal aspect. Now we are doing the temporal part, and this has again anesthetic in here, so just making it a little more comfortable for my patient really.